targeted violence, including criminal extremism, is a threat affecting the whole nation. Veterans and military family members are not immune from the threat, as targets or as perpetrators. This concerns everyone, the veteran community, all Americans, and the world. It is our responsibility to collectively take steps to prevent targeted violence. Luckily, there are mitigation strategies that can be adopted to help prevent targeted violence within the military community. Specifically, applying the public health model to this issue provides us the opportunity to better prevent targeted violence. As a commonly adopted model for preventing any number of health concerns, the public health model for targeted violence is a comprehensive approach that envisions building thriving communities and individuals resilient to violence, and by extension, criminal extremism. It focuses on minimizing any negative conditions or risk factors that could lead to targeted violence taking root, while boosting protective factors or those conditions that help inoculate communities and individuals from susceptibility to targeted violence. Through multidisciplinary and multi-sectoral work, communities can build resilience and strength. Within a public health model, prevention consists of activities to protect people from actual or potential threats to health and their consequences. Prevention can be broken down into at least 3 tiers: primary, secondary, and tertiary prevention. Primary prevention programs are typically the largest in terms of scale, focusing on large sections of the population, and usually try to protect this population against exposure to risk factors that lead to harm. In the field of violence prevention, primary prevention targets the whole community, most of whom will not have engaged in targeted violence or otherwise supported targeted violence. Frequently, primary prevention programs focus on increasing awareness of the problem and its root causes, or in informing the population of warning indicators related to targeted violence. This may include activities such as getting involved in our communities, supporting youth resilience programs, supporting engagement between law enforcement and their communities, actively raising awareness, providing training such as bystander training, and conducting efforts to improve digital research skills. Secondary prevention in public health targets populations that are at higher risk, in this case, of participating in targeted violence. Prevention programs at this level address attitudes and behaviors short of violence that may be of concern. These interventions are intended to prevent people from progressing to violent behaviors. Secondary prevention programs may include referral services, threat assessment and management teams, and other intervention or individual community-based coordinated services, also known as wraparound services. Tertiary prevention is aimed at persons with demonstrated violent behavior. This tier of prevention programs seek to rehabilitate and reintegrate individuals who have engaged in targeted violence and to prevent future violence. Tertiary prevention programs may include intervention services, including wraparound rehabilitation services and local governmental and community leadership following an attack. As shown through the tiers of prevention, the public health model for targeted violence prevention spans a wide range of activities that provide many opportunities for members of the military community and those that serve them to become involved. Whether helping a friend at risk, participating in bystander training, volunteering for programs that help build community protective factors, working in veteran and military family organizations to provide prevention or intervention services, or advocating for adoption of prevention strategies by the Department of Defense to help both active military members and veterans. You can be part of the solution for preventing targeted violence. To protect each other and the community at large against targeted violence, we must use our relationships and connections to find each other, support each other, and lift each other up.